Did you know that there's 8 different types of waste that can occur in a process? These include activities such as working to the top of your license. We refer to that as underutilized talent, transportation of materials or patients, too much or too little inventory, extra motion, extra processing, defects, overproduction, and waiting time. There is a handy dandy acronym that we refer to as DOWNTIME, which can help you memorize each of these wastes. So let's review each type of waste with specific examples that illustrate inefficiencies in the system. Some common defects in medical operations include bad outcomes from operations, incorrect diagnoses, and medicine administration. Miscommunication issues and lack of proper documentation issues can also hinder the downstream processes. So let's look at some extreme cases. For example, if a surgeon were to leave excess materials inside of a patient during an operation, this would be cause for potentially severe complications which would require additional surgery. That's a defect. Incorrectly taken x-rays are defects because they can lead to a misdiagnosis, cause delays of appropriate treatment. And let's also say hospital-acquired infections would be a defect because it would increase the patient morbidity and prolong their hospital stay. There's a tool which encourages teams to document the root causes that may be affecting and causing defect. A simple checklist that helps to document what were the contributing factors for the error. This checklist comes from the U.S. Department of Health and Human Services and is available online. It's a widely accepted reference with a comprehensive list of the most common factors for defects in healthcare. All right, so the next type of waste is overproduction. In healthcare, this includes things like multiple forms that ask the same information: the patient's name, their age, their home address, their insurance number. It can also be things like unnecessary procedures, such as extra lab work that wasn't even requested, premature preparation of procedures that were not going to be performed, early medication prep, early batching of case cards, and stocking of supplies requiring removal from the rooms are also examples of overproduction. Waiting time is probably the single highest patient complaint. This includes waiting to make an appointment with their PCP, sitting for a prolonged period of time in the waiting area, waiting in the exam room for the provider to come in to administer the exam, waiting for the lab work results. And by the way, waiting also applies to the healthcare professionals, as they too must wait for available resources, data, supplies, or even their patient to get gown. Most lean projects in healthcare address this issue either directly or will indirectly impact waiting time. In fact, an informal feedback survey taken from paramedics and EMTs highlights technology issues causing delays and patient turnover. Identifying and addressing these inefficiencies is crucial to reduce downtime. Some comments included things like inadequate training that was provided, equipment that was not working properly, staff who take too long to provide a sign-off approval, and computer systems that don't interact properly, keep changing, or don't have needed features. These all impacted waiting time, and it was crucial to get to the root cause in order to minimize that prolonged waiting. N is for non-utilized talent, which includes medical professionals doing others' jobs. Examples are doctors and nurses doing tasks in place of others. It can also include improper training or people that are not trained properly to do the job for which they are in the position to perform. Not engaging people who are on the front lines to identify solutions eventually leads to lack of engagement and employee burnout. These issues need addressing to improve workplace efficiency and morale. I've also heard medical professionals describe this issue as not being allowed to work to the top of their license, so their talent goes underutilized. Patients often face excessive transport for various procedures related to the same medical issue. They get moved from room to room to room, up and down the stairs, elevators, and so on. Additionally, the transport of medication or supplies is challenging when the pharmacy is located far from the patient or the supply room is located on the other end of the clinic.
Here, we highlight two main issues with inventory. The first one is expired medications, thereby making them ineffective
Or safe and must be discarded. The second issue is excess purchase of supplies, which will flow to the clinic's bottom line. Similarly, having the wrong types of supplies lead to other types of waste and cost.
A poor hospital layout causes excessive motion for the PCTs or the nurses
when administering medications, and probably requires the lab employees as well to move in between rooms throughout the day. Looking for needed supplies is also one of the most common types of motion waste. Excessive processing in the clinic setting includes unnecessary data collection, repeatedly documenting insurance information, and the lengthy triage process. Streamlining these steps can improve not just patient care, but will also impact the wait time that we described earlier. Examples of extra processing include information that's collected but is just never used again, multiple date stamps for the same service, reiterations of insurance information within the same visit. In an article called A Simple Answer to 55 Different Questions, Triage and the Emergency Room by Dan Littlefield, published on October 2013, he noted that over time, the patient assessment was gradually pushed from the ED to the front office, meaning that what should be done, when it should be done, and where it should be done for the best interest of the patient has taken a backseat to more and more paperwork. To improve this, clinics should focus on performing the work that is absolutely necessary at each step. This will keep patients flowing through the process efficiently without impeding for their care. Okay, and there you have it. Downtime summarizes the 8 different types of waste that you'll often come across. Next, we'll discuss how you'll observe these process inefficiencies.